Concussions are usually associated with athletes. Broncos wide receiver Wes Welker, you may recall, missed several games this past season to recover from one. While athletes may experience more concussions than average, they can happen, in fact, to anyone, and even one can have long-term effects. 9 Health reporter Dr. John Torres shows us how an alternative form of treatment is helping a former Bronco.
As a tight end with the Seattle Seahawks and Denver Broncos, Jeb Putzier took thousands of hits, which he says resulted in hundreds of concussions.
Anywhere from 500 to 1,000. It's hard to really tell because pretty much every day at work.
Putzier left the Broncos and football in 2005, but Putzier says he continues to suffer side effects from years of concussions.
I was having trouble sleeping. Word finding was a really tough one. Playing my guitar, I was having trouble remembering lyrics or talking.
Now Putzier says he's feeling better. Under the care of Dr. Shane Steadman, a chiropractic neurologist in Englewood, Putzier is undergoing what's called visual restabilization.
When people have concussions, very often their whole visual system gets thrown off. So what we try to do is we try to bring those pieces back together.
To do that, Putzier is put through a series of visual exercises, including this one. He's trying to focus on a moving target.
Better that we can get the visual system to communicate with the rest of the brain and how the brain communicates with the visual system, we start seeing changes in how people can live their life.
While it looks fairly simple, Putzier says he's already seeing results.
Having this has been helpful in my job and everything that I'm doing daily, just going around and just being normal again instead of having those mood swings.
It's important to remember that concussions affect everyone differently. So while this treatment may work for Putzier, it may not work for someone else. It's always best to talk with your doctor first. For 9 Health, I'm Dr. John Torres.
And Dr. John says that most people who do get a concussion do not suffer long-term effects. Dr. Steadman emphasizes early treatment to make sure the brain fully recovers as quickly as possible.